Good morning, everybody, and welcome to our webinar. Today, we'll be talking about achieving more with data-driven healthcare services. Thank you, everyone, for joining, and I'm delighted to see that we've got some people attending from some of our major UK organisations who support our healthcare system. That's fantastic to see. Thank you. If we can go on to the first slide, that would be great. Thank you. Just before we begin, a couple of hygiene factors. So questions, if you do have questions, please do drop them into the questions box that you'll see on the dashboard, and we'll be answering those towards the end. If you do have certain subject matter that you would like to for us to discuss during the webinar, please do also pop that into the question box, and I'll pass those on to the speakers. And that maybe we can use those as examples as we go along. So please do speak up, and we can adjust it as we go along. At the end, we will be sending out a survey. Now, these surveys are really important so that we can make sure that the webinar content is really relevant going forward. So that really helps us to plan out future events. Thank you. And lastly, we will be recording the session and we'll send it to you afterwards. Please do feel free to share it with other members of your team. Okay, just talking a little bit about our agenda. I'll talk a little bit about our experience in healthcare and introduce you to our experts who will be talking. The first segment is all about healthcare statistics. You're really looking at the numbers and highlighting some of the key issues that we're facing at the moment. Then we'll be going on to how analytics can help with these issues. Then lastly, we'll be talking about some user stories, and we've picked out 4 cases where we will look at the data and see how we can help issues such as readmissions and cancer care. Then lastly, at the end, as I say, we've got that question and answer session. So feel free to send through those questions. Next slide, please. So just introducing us, my name is Hannah, and I've been working at invenioLSI for the past 5 years, heading up the marketing. You'll see me now, and at the end, I'll be hosting the question session as well. We have Sunaina Thakur. She'll be talking first, and she is our analytics digital champion. She's got over 20 years experience designing and implementing digital analytics solutions. She's also an avid writer, and you'll see many of her blogs on our LinkedIn feed, so please do go along and have a look at those after this session. We also have Abir Chakraborty, and he is our chief data scientist. His career spans over many companies such as IBM and Deloitte, and he's passionate about creating actionable insights from data. Some of his latest work includes using the power of digital analytics to predict the likelihood of strokes, and he'll be going into that in a little bit more detail in one of the use cases that we'll be discussing later. He also has a great gift for explaining very technical solutions so that we all understand them and the benefits they can bring to organizations. Moving on to the next slide, please. So invenioLSI, we are the #1 independent SAP solutions provider servicing the public sector globally, and we have our headquarters here in the UK. For over 15 years, we've been providing technical consultancy in local and central governments and public sector organisations. Some of these logos here that you see on the slide, these are healthcare organisations that we've been working with over the last couple of years. We've installed powerful back office systems, which include S/4HANA, and they have increased the efficiency of the organisation as well as lowering operating costs. We've also used digital analytic capabilities to create proactive solutions which lower incident numbers and waiting lists, which again we'll go into a little bit more detail later on in this webinar. With that, I'll hand over to Sunaina, who will be talking through the first part of the webinar. Over to you.
Thank you, Hannah, and welcome everybody to this webinar. I'm your digital champion, Sunaina. I'll be taking you through the rest of our point of view on digital health and digitalization of healthcare. To start with, what a wonderful 2 years we've had in which we've seen how digital could really make a remarkable difference to everybody at large, the whole world and the population with the corona pandemic raging, and the whole cycle that we saw from the concept to the communication to the actual care and the clinical pathways that were digitalized. Then we saw the whole vaccination being dispersed, and everybody is 3 times jabbed, if not more. So we've seen that, and there are many other trends that are going on in the health industry which talk about how digital is really truly changing the ways. We have heard of robotic surgeries. We have heard about twin health twins, which help you lower your diabetes and others because you're being monitored over a period of time, and it's really a digital twin that's being taken care of. Have you heard of life expectancy going higher? We've heard of virtual doctors. We've actually seen them in the time of coronas. So all of this is great and going on, but when you see this flashcode in front of you here, which talks about the UK health statistics, really the picture is slightly somber, if I would say. And if you could see here, these are all statistics from the UK Gov sites. We have a very high per capita inpatient care expenditure, almost pound 3,000 for every person. The adequacy of citizen medical infrastructure isn't really enough. We have only 1 bed for every 430 Brits. Almost 5.6 million cases are pending in the hospital care. And with all of these challenges, and you all know about it since some of you are from the health authorities, there is an ambition of quality in the healthcare, which needs to be patient-centered, needs to be safe for the patients, safe for the operations, get efficient operations in line with the patients, make it more effective and equitable for the diversity that the UK has with respect to ethnicity and diversity that we have. And of course, timeliness. So while we are striving for all of this, we do have a problem. So are we really there yet? And if not, then what is the next steps? At invenioLSI, we think there are two-pronged solution or two-pronged answers to this problem for the citizen centricity that we are looking at, and that's proactive care, and proactive care driven by data. We understand there is data available to us with the healthcare authorities, even with the retail outputs that we have. We have the primary care data, diagnostics data, critical care data, wearable data with the retail outputs that I was talking about earlier, and also citizen demographic data. So with all of this data, really, we should be able to drive that engagement, create those operational efficiencies, and be able to digitally change our clinical pathways to help those three problems that we talked about, which is the infrastructure, the wait times, and the expenses that we are incurring. Proactive would really lead to the well-being of the society at large, and that's what we believe in. How are we going to take you through the point of view as we go along? So if proactive care and data is the answer, we would see the impacts on the ground. And these are some of the excerpts that we found from the NHS workers and NHS patrons who are here. There are questions on the field which can really be answered with small solutions, and it's time we start talking about them and getting them into our ecosystems. The first one being patient-centeredness. How many times have we had somebody have a flare of migraine and would want himself to be communicating with his carer at the same time as the GP? And that's something that you can solve with this easy engagement channel available to the citizens. There are concerns for safety of operations and clinical procedures, and there is a plethora of information there in the interventions or unsuccessful interventions that have happened in the OT rooms that could really feed into the root cause analysis and future monitoring for cases to make it more safe in the clinical procedures going on. How many times have you heard that a diagnostic case could be really made, could have been made more enriched with data coming in from other counties where similar situations or conditions have been cited? The availability of the information at the time of emergencies and anytime access is another something that is needed all the time. You would have somebody signed up for being an asthma patient and have historical data, but to make that data available actually at the time of emergency is something that I think most of you look after and look for. How do you get that anytime access? Is there a way to share, seek, search our data and give it for a second opinion to some GP that who's a relative? Is a second opinion possible through availability of data at the right time in the time of emergency? Well, a health concierge can probably do that. Digital assistants are the way to go, and they are really technology that can be lift shifted and be executed very easily. How often have we dealt with manual errors and errors in understanding a report format from the other, where our technicians and our radiologists make those faults and they are taken to the diagnostics. These can really be solved with some very simple tools and digital aids on top of data that we're riding on. So really, what we were talking about is looking at where we are and talking about the art of possible with data and proactive care. One of the examples, as you see here, is on the NHS website. We have data for the population. It's a national health check program which has data for a decade, almost summarizing and aggregates of the conditions by demographics and by the criticalities and others. If this data was to be made more enriching, wouldn't life be easier for the patients and the carers? An example there that I quote is health is wealth. We have wealth accounts and bank accounts and the whole digital world going after it, and you do so many transactions and you look at your bank account. Why can't we have a health account which is digital? Why can't we sign in and see what is my status of health at this point of time today? All of this data available with the public sector and the UK health authorities is something that we can conceptualize and think through as that health account, and that's what we think can be changed into this national health check program, can be enriched and made more predictive, more personalized, more assisted with intelligent feeds and powerful insights as part of it. Just an idea, but and there are many ideas, as we said, but and there are many data science use cases and a lot of people doing a lot of good work there. But what is it that invenioLSI has that that we can talk about here? So the USP that we talk about is regime-based affirmative scoring. It is like solving a needle in a haystack problem. And please hear me out. When we say a needle in a haystack and we're trying to find out the needle, what is it that we're looking at or trying to find? The needle? Should we look at the needle or should we look at the hay? At invenioLSI, we think it is the hay that we need to understand, and we do that with affirmative scoring. So for all the data science quantified scores, which you see here on the left, whether it is a vulnerability score for a mental health condition, or it's a risk score for a critical ailment, or it is a quality of service score for an ICU or a ward or a facility, or it is a recommendation score for the step or the pathway towards diagnosis, or it is a sentiment score from social data which talks about how your customer has been thinking of your services. How do you identify what is the anomaly? And we believe the way to do it more precisely and effectively is through understanding the hay, and once we do that, needle can really be found. So that's affirmative scoring. For regime-based, if you think of the situation, finding out the needle in the haystack when the room is dark, are you really able to do that? And our answer is you really need to turn on the light. And what is that light then? The light is the macroeconomic factors or the external factors, which are perhaps things that are not made part of your data science regime or data science routines. If we do that with the domain experience or the expertise that we have as specialists, that could be raked in and make our algorithms more powerful and more predictive and have much better and efficient results. Then I would lead you to think further when you go through the use cases that are there with Abir, our chief data scientist. He would be taking you through the user stories and how we have done this in the field of healthcare. Over to you, Abir.
Thank you, Sunaina. Thanks everyone for joining in, and your time is really appreciated. Can we go to the next slide, please? Great. So at invenioLSI, we have worked with multiple partners, and we have worked with various data set that is available for us, all aiming at making a citizen's life better by using putting data in the center and solving problem using that data that is placed at the center. we have we have we have we have developed multiple use cases that we believe could be helpful in helping those problems that we face, specifically related to healthcare. Today, we would like to focus on four of our focused healthcare data science problem that we have identified and used data at the center to solve those problems. The first one that you would see today is the power of data and time-driven data, where we can predict quality of services, specifically for cancer breaches that we have from NHS website data. Then you would see how social media could be used to understand the trend, understand what is going on within the social media user group, where users' comments were largely anonymous. Then we would have the third use case where we would see socioeconomic data uh, and diagnostic data combined together as a form of regime-driven analysis and use that to do a causal analysis. That use case also has a part where we are working on how we can use scan data to predict whether a patient might have a stroke or not. The scans are CT scans. The fourth use case is where we have picked up a problem that we have seen is quite common is readmissions. We have used again a regime-driven data to pick up socioeconomic factors of a patient and use that regime-driven data along with the, uh, the diagnostic and healthcare related data to predict if a patient might get readmitted or not, and have given them affirmative risk-based scoring and use that scoring available to the healthcare when they get discharged. So with that, I'll start on with my first use case. We have seen a common problem where getting data from for healthcare is a big we find it difficult to get it, but glad that some data is available on NHS government website, and we have used data for the cancer uh, cancer related the quality of service that we receive. So these are the data that you see here. These are cancer breaches data that is available on NHS government website, and we have used this data to first put a picture of descriptive analysis of the data, which means how did the cancer breaches happen within last 10 years? What was the quartiles? Where was the mean, and how it was distributed across? As you can see in 2019, the amount of cancer breaches swing a lot between all the NHS trust in England. It swinged quite heavily, but some of the year there, like for example 2021, 2015, 2016, and previous years as well, where the cancer breach that took place within the year was the swing were quite low. The standard deviations were quite low as well. Uh, this is we don't have a cause for this right now why that happened, but it's good to note that given it's a descriptive analysis. Thereon, we thought of predicting how could the cancer breaches go on if things remains like that, what remain like that the way it has been. And with that, we have done a rolling prediction on how the cancer breaches would look like. With COVID now going away, hopefully, um, we can see that in 2022, the amount of cancer breaches is going to go up quite a bit. But thereon, that increase in cancer breaches is going to slow down a bit, but still in general is going to go up. As you can see from a screenshot here, uh, the amber line gives us the prediction of number of cancer breaches that might happen. This is a rolling forecast, it's a time series forecast. What it doesn't include is other macroeconomic factor or other detailed factor that we think might be possible that can affect the cancer breaches that we have. We are restricted a little bit in terms of the data that we have, so we could just do a univariate analysis on this data and predict from there on. This is art of possible, and we can do more depending on the data that we might get hold of. Um, with that, we go to the next slide, which is our next use case. Um, this is the use case where we have recently scraped the data of around 3,250 tweets and retweets that has been made to the NHS Business Service Authority Twitter handle. When we go into Twitter feeds and of any handle, we can scroll through all the old tweets, we can look at the retweets and things like that. Quite verbose, and we don't understand more or less in general what the whole picture of the whole tweets is being given there. What you see here right now is actually 3,250 tweets all at one screen. Let me explain you a little bit more about it. The x-axis, where x is equal to 0, is the most recent tweets. Anything which is near to x is equal to 0 is more recent. And as we move along y-axis, we are going towards the older tweets. The central line where y is equal to 0 is the one where we feel that the tweets are morely neutral in nature. The sentiments are quite neutral in nature. Anything on the right hand side is highly positive in nature. Anything on the left hand side is either negative, or it points a picture of where we need to have some sort of attention, some sort of discussion is going on, or something that might need some action as in general. In terms of color, anything on the red side, uh, which is positive to go towards +1, is very good in nature. Either these are congratulatory messages, or these are accomplishments, or these are something which is highly positive and written very well in terms of English language. Anything which is in blue color, light blue or deep blue, is something which might be a little bit of negative in terms of the words that has been chosen. And the more deeper the blue color is, the words are really kind of little bit towards the harsher side of the English dictionary, as what the natural language is being determining at. This is the machine-driven language we have used, and we have also used these scraping of data for other languages as well, given the fact tweet could be in non-English languages as well. This next screen is basically summarizes it on the left hand side. How many tweets were positive, how many tweets were neutral, and how many tweets were negative. If I'm someone who is in charge of this, the public relationship, I might look at all the dots which you see in the last screen. Those are all clickable dots, and you can just drill down more on every tweet that we have. And I might go and retweet and look what is going on. On the right hand side is a very interesting picture here, which paints up is the top 5 trending topics that we have. And one of the important topic which somehow correlated with the news that was going through the in the media of electronic prescription services. And it tells it there were a lot of discussion that is going on in terms of how electronic prescription services are being dealt with, and what happens if some of the services, free services, are being removed at. There's also COVID vaccination, mental health work that is going on, and other COVID related discussion that is going on. We could dive deep into it, click on any of the topic and go more deep on it and see what are the tweet trends that is going on. And there are other lot of analysis that are available to cut and dissect, slice and dice the data and understand where geographically these tweets are coming from, what sort of age group they have, and things like that. If we go to the next slide, please. This is the use case which is very it's quite important to us. um, Two major problems that NSS is facing according to their website. One of them is stroke, and how much money we spend in terms of handling stroke patients, handling stroke cases, and so on. This use case is divided into two parts. Number one is the causal analysis, where we have done an affirmative risk-based scoring on a regime-driven data, where we have combined diagnostic data, lifestyle data, and the socioeconomic aspect of a patient, combined the data to understand and did a causal analysis on the data, where we have found any factor that is statistically significant, where p-value is less than 0.05. We have picked that KPI and tried to dig deep more into it. What is so it tells if there is a stroke. A given KPI is statistically significant to specify um, that might have a cause into it. That doesn't mean that that's definitely is the reason why a stroke happens. For example, we have seen that the senior citizen have a higher risk of stroke, nothing major in it. But what we found very interesting is the average glucose level that is found in a patient when the stroke took place. That the level of glucose is not highly correlated with the stroke that's happening. In terms of socioeconomic data, we have seen that uh, the, the sector in which a particular patient is working is how the private sector people have. We have seen they are highly correlated in getting stroke rather than people working in public sectors. Uh, in the right hand side, we have done some image analysis using open source and Google Cloud Platform. It's divided into two parts with four CT scan images. On the left four is the one where these are the scan images where a patient got a stroke within 4 weeks of taking the scan. There could be multiple scans, but these are the first scan that has happened within the 4 weeks of range. And the right hand side is the scan images where there were no stroke that took place after the first scan, and from there on the next 4 weeks. Um, we have created a model where we have trained a computer model in Google Cloud Platform with those images, around 8 GB of data, that it gives a affirmative score, a probability score, and once we give a new scan data to that particular model, it can give me a probability score value, which tells me whether what is the probability of having a stroke in it. And if you pass it through a sigmoid function, I can draw a binary value of whether the patient might have a stroke with a 0 and 1 within a 4-week of period. Um, this is what we have done so far using the data that we have with us. If you go to the next slide, please. This is the last use case that you would see today, and this is again one of the major issues that we found within NHS website. One point of concern is readmission, how much we spend in terms of getting treating the readmitted patient again. Now what we are saying here is we have done again a regime driven affirmative score. On the right hand side we have around 74,000 records. These are all dummy data that we have created within our understanding of healthcare, and it includes quite a facade of data. Number one is the diagnostic data, number two is the socioeconomic data, and number three is the overall general economic environment that we are in, which includes COVID, which includes inflation, which includes the GDP of my country. It's generic, that's why we have considered GDP, but we could go more deep into a specific county or maybe a specific hospital trust level data, and where the patient come from and what area they come from and things like that. Now, as you can see, it's finding a patient that might get readmitted is a needle in a haystack, but our affirmative scoring, which is nothing but creating an ideal condition, ideal centroid for every risk-based score, and understanding the 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 uh, the, uh, the distance from that centroid to the patient data, which is basically a vector or an array of data within the KPIs that we have listed in there. With that, we have given a score of low, medium, and high. This is not this is something which a doctor or someone in NHS can see in their screen when they are planning to release a patient, and may guide them to understand how the release should happen, whether a patient is a high score, a medium score, or a low score. With the data that we have, around 90% of them were low score, so good to go kind of a scenario. The patient who were amber, we might see what we can do in terms of the release, where they are going, whether they're going to a care home, they're going to their own house, and other KPIs that we have. And the other patients who are in a red zone, which means they might go back to a environment where chances are very high that they might come back. That includes mental health, that includes their family background, that includes again the socioeconomic factor where they come from. So we might think how we might handle these cases. So yeah, with that, I finish my set of use cases, and we'll be happy to take your questions when we go through our questionnaire time. Thank you.
Brilliant. Thank you very much, Abir and Sunena. We do have a couple of questions that have come in. Firstly, I think one for Sunena. Could you explain a little bit more about affirmative scoring that you touched on earlier? Oh, I think you might be on mute.
Yes, so the affirmative scoring is really a practice we employ or deploy in our data science runs, by which we take data that is good data and assess that to find out the anomalies. And this is really applicable across all our use cases, whether it is finding a vulnerability in the population of a mentally vulnerable citizen, or it is about finding vulnerability with respect to risk, a fraudulent transaction, or score the ones that I mentioned. But most of these can be sorted through affirmative scoring more precisely and effectively than actually going to find the anomaly by training the models on anomaly. So I would really like Abhi to chip in on this with his experience on the readmissions, which he's trying to do using affirmative scoring.
Yeah, sure. It's a very good question. And at invenioLSI, we have designed this affirmative scoring. What this is we take data. So normally when we run any machine learning model where it's um, unsupervised, where we don't know what is the outcome, or we haven't seen, for example, giving a risk score to a patient. We haven't done it earlier, for example, but we give the data. We give data to the model, and what does model does is it creates it first understand what is the risk, how many risk categories it could be. So the data that we had, it was divided into 3 risk categories. It could be more depending on the data that we have, and it creates a idealistic point within an XY plane, for example, if there are only 2 parameters, and those 2 parameters are basically then for example, medium and low and high and green, which is so those three are basically our centroids, and these are idealistic centroid. Then we take a equilibrium distance from every centroid to a particular patient data, and that distance tells us how far that particular patient is from the centroid. This is affirmative scoring. This is where we say that we have given a score to a particular patient from how far they are from a given centroid, and how far there are chances that they move from that centroid. For example, if a patient might not be applicable for a risk scoring that we saw now, but how far is it possibility that a patient can move from one centroid to another centroid? Given the fact, for example, if a patient is going to a care home during a very high COVID time, where there might be not many patients back in the care home, not fully vaccinated, the score might be that patient who's going back into that particular environment might be maybe a medium risky patient. But if the other factor around that place where they are going back, that increases, that goes better, then the patient might be less riskier now, because the environment where that patient might be going in is much better than what it was previously. So we constantly monitor that. We understand how other factors, it could be socioeconomic factor again, as I say, it could be mental health related factor where the patient is going back to their home where they come from, and how is the environment over there. We don't paint a picture of everything as a 2 binary colors or 3 binary colors. We look at the facade, we look at we understand what are the other socioeconomic and other factors are involved, even economic sector as well, where the patient is going to the office or work and things like that. So it's highly data driven, and it can go in depending on what sort of data we have access with. So hopefully that answer your question, whoever asked it.
Yes, thank you very much for that. We've got a couple of more questions. So Naina, would you like to go first through Invenio AI capabilities first, and then we'll do a couple more questions at the end?
Yes, and there are a catalog of capabilities that we have already in our portfolio, which are demonstrable, which we can create with data sets from healthcare organizations, and which we have done with our customers in the past, and where we deploy our regime-based affirmative scoring patterns. Also, we also have with our SAP expertise, we have created analytics on top of the HR, SAP, finance, as well as procurement modules, which we call as invenioLSI, ERP Health One. This is a set of data-rich KPIs for health institutes. Please do let us know if you have interest in seeing any of these. Profiling a critical quality of service prediction, social sentiment analysis is something that Abir already touched upon. Those are again demonstrable, and we are happy to take you through them on a deep dive and engage with you more on the data sets provided by you. We do have a predicting vulnerability demonstrable, which talks about creating a trouble score for troubled families in case of social care sector. That can be extended to healthcare for finding out vulnerable with respect to critical ailments and others, and people at a risk score of conditions like CVD or diabetes and etc. We do have integration solutions which have digital capabilities like chatbot, voice recognition, and IoT sensor recognition that we can help you with. We do have data science models on call center analytics, which talk about tonal analytics as well as decision making for prioritizing the calls at the call center and for service support. We do have use cases which we are doing with our customers on robotic process automation using our partnerships with UiPath and SAP, and we're happy to deploy them for you on any of the manually heavy processes that you have, which include a lot of documentation and others. So happy to discuss with you and deep dive with you in any of these, but at the same time, we are trying to create the health account for citizens as a concept, and that's something that we would like to hear from you on. Happy to hear questions now, Hannah.
Great, okay. Abir, I think this is a question for you. There's a question about protecting the privacy of citizens and how we use data ethically. How would the invenioLSI model protect citizen data?
That's a very good question, and ethical AI is in itself is a quite a good topic and quite a relevant topic. And so two part to that question. Number one is how we deal with data privacy, and number two is what we do with the data in terms of ethically working with it. Now there has been a lot of discussion going on in terms of how bias is built into the model. It's an important topic for data scientists, and though bias technically means how easy the model is, and that's what the definition of data science definition of bias is, and there's a trade-off between bias and variance. But for us, what we understand from ethical AI is bias is when we give weightage to a particular KPI more than what we think it should be, and we built in some outside knowledge which is not from the data and put it into the model. That is something which is very important, and it's a very important topic, and there are a lot of seminars that goes on, and where people have tried to educate their population about how the AI model in the backend works and how it deals with your data. And at invenioLSI, we have tried to take a little bit of it off by understanding the KPIs and their importance by their statistical point of view, rather than giving them a specific weightage. Which means we ask the model, the data science model, to tell us the weightage which it thinks out of it, which means we can prove it mathematically. There are a lot of hypothesis testing, there are a lot of statistical testing that are available to prove that why we have given a weightage to a particular KPI, and that somehow a little bit takes it off human judgment in terms of what sort of weightage or what sort of um, uh, factoring effect a KPI might have in terms of the model. So that's the first thing. The second thing is the privacy of data. Now we feel that data the owner of the data is the person whose data it is. We are just the guardian of it. We are just the keeper of it, and we feel that as a responsible guardian of the data, we only deal with the data that is given to us to be part of that model. And there are a lot of law that is governed by that, these scenarios and these principles. And for me, it's good for me to deal with the data that is clean, that is there for me to use, rather than try to predict missing data and try to predict data that is not there for me to use. I would rather use data that is good, or maybe good, and can be used in my model. So that's one thing that might leave certain things through the net, but it's better to deal with what we have rather than going against that what we should not or we should. So there's framework built in, and there is it's open for us to interpret what's going on underneath. So yeah, that's how I would say. Hopefully that answer your question, but happy to explore more if further questions are asked in that topic.
Great. Thank you very much. Next, we have a question about digital accelerators. Sunaina, this person's asking, how can a non-integrated facility still make use of digital accelerators?
Okay. Well, if you're not integrated and you are really starting slow in your journey towards transformation, we really recommend an MVP approach, which is with a proof of concept. So while you're building in your trust in our practices and getting the value out of data science models that you deploy on the data sets that are existing, which could be siloed, which could be manual. But going forward, you could work on a roadmap which then zeroes in on the plan for complete digitization. And really, integration is the need of the hour. But if we can take small steps by doing these smaller pilots and bringing in the confidence on the outputs, we could really stitch them together going forward in a roadmap for data governance, building up data governance, data trust, and data architectures that reside for long.
Perfect.
Hopefully that answers.
Yeah, that's perfect. Thank you very much. And then I think lastly, Abir, a question about the quality of data. So the quality of data may be substandard or incomplete. Can our invenioLSI model still solve that issue?
Yeah, it's a very good question, and it's a so again, to answer this, again there are 2 points to it attached to it. Number one is the quality of data and how the model can work with it. Now there are a mechanism, there are ways by which we have worked with multiple clients of ours where we have seen that there are some missing data, there is data quality issue. So as from your last question, in terms of digital journey, we have seen that a lot of clients have started with their digital journey, or they have matured quite a lot in their digital journey, or anything in between. people using Excel and to do the analysis, or people using big data to do the analysis, and again everything in between. There's no good point to say when their digital journey start and where they are, but we have seen with anyone within that digital journey that quality of data is a big issue. And for us, example, when we are working in this any sort of we identify a business problem, we think of solving it using data, but the first roadblock that we have is any healthcare data is difficult to attain. We can't get data for it. And though we have a lot of mathematical idea, a lot of brainstorming session that we put in for any business case, any healthcare related issues that we identify, we can't go beyond a certain limit because we might be because our hands are tied in terms of what data is publicly available. So we would really love to explore data and understand, because our main concern is to solve business problems, solve to make citizen life better by using data. And to understand that, to work with it, invenioLSI would invest time and with any service provider and work with them to understand how data can help it. Coming back to the question about quality of data, sometimes we have seen that when we have engaged a client to solve a business problem, we have not only solved that business problem using data, but we have, during that journey of solving the business problem, we have identified the quality of data which client wasn't aware of initially when they started the business problem, solving the business problem. So basically aiming at aiming at two business problem by one single work of solving that business problem. And we have realized how the data is, the quality of data. Sometimes we have corrected it at the source, or sometimes we have extrapolated, even predicted data to make the model better, and understand how data could be cleaned, how data could be corrected, even how data could be integrated, as Sunana just mentioned. So it's a very generic question. I hope I have answered it, but it's it's a very important question, and it's open up a lot of other topics to be discussed at. So yeah, sorry, I can't go more detailed because I need to understand what sort of data we are talking about, and other factors as well. Like, can't be a but yeah, try to explain it as much as I can. Hopefully it answers whoever asked it.
Yes, absolutely. I'm sure they will follow up with further questions with more specifics about what kind of data. Thank you very much. That draws the questions to an end. It's been a fantastic webinar, particularly the subject matter around the scans. I thought that was really fascinating. Thank you very much, Sunana and Abir, for your time, and we will be sending out the presentation to everybody, and we'll be sending out the copy of this webinar. Thank you very much for everyone who's taken time to attend, and the fantastic questions that you've also given us as well. So I hope that's really shed some light on how data-driven solutions can help. Do get in contact if you've got any other questions, and we'll be happy to help and give you some helpful advice, I hope. Brilliant. Thank you very much. Have a fantastic day. Goodbye.